Hello and welcome. This is Intimacy After, a podcast for mature women facing intimacy issues from various causes. Please know you are not alone. It is time to stop suffering in silence. On this podcast, we give hope that through practice of simple steps and proven tips, you can improve intimacy and resurrect your love life. Break free, learn to laugh again, to play again, to be happy, to love, and know that you are loved. I am your host, Queen. Come on inside. Hey, sister friend, welcome inside to another heavy discussion about the things and topics that you care about, things that directly affects you. Today's concern is about heart attack. I've heard you. You send a lot of topics and I'm sifting through them one at a time. So the one that gets the most requests, that's the order that I typically go in. And so today we're going to take a look at heart attack. Are you at risk for having a heart attack or causing a heart attack during sex? It may sound funny to some, but this is serious business, right? Back in the day while in the military, some of the guys would joke that a heart attack during sex is a great way to go. Many are finding out, though, that a heart attack doesn't always lead to death. So your questions about re-engaging in sexual activities are very valid. But before we can talk about heart attack and its effect on intimacy in sex, we have to first have a good understanding of why this is so very important, and then exactly what a heart attack is and is not. I realize that about a quarter of my listeners are in the UK, Canada, and the Caribbean basin. Thank you all so very much. But using a basic information from the US stats may be relatively close for your population. So I thank all my listeners and I want to be as inclusive as possible. So I'll use some of the statistics from US and why this is so important. So according to the American Heart Association and the Center for Disease Control and Prevention, CDC, about 805,000 Americans have a heart attack each year. Of these, 605,000 are first-time heart attack patients, while 200,000 happen to people who have already had a heart attack, right? So if you do the number, that's roughly about 1/4 of the folks who had heart attack before had heart attack annually. So heart disease is the leading cause of death in the United States, accounting for about 1 in 4 deaths. Now, again, for the UK, Canada, the Caribbean basins, or any other country, you may not be too far off, but you can check the statistics for your country. But here is the even scarier part. Well, what could be more scary than dying from a heart attack? Well, about 1 in 5 heart attack is silent. The damage is done, but you are not aware of it. Isn't that scary? Very scary indeed. We have seen in the movies and or heard about people dying during the act of sexual intercourse from heart attack. Nothing about the scenario is funny, especially not for the survivor. How traumatizing, right? So I have to ask myself, physician or no physician, sister friend, I am human just like you. So when they said about half of Americans have at least one of the leading risk factors, I stopped and listened, and you should too. We'll get more into those risk factors in a bit. Let's do a quick terminology pause so that we can relate and stay on the same page. If you're going through your medical chart or records or come across the term myocardial infarction, it's the same as a heart attack. I was asked in the past if infarction is gas. No, it is not the same as passing gas. No shame. Some words can sound similar, and in the medical field, it can be quite confusing. Don't believe me? Take a look at some of those medication lists. If you don't ask, then you won't know. So, flatulence is passing gas. Infarction is something totally different, sister friend. You may have read elsewhere that a heart attack, myocardial infarction, MI, occurs when the blood flowing to a part of the heart muscle is blocked, causing tissue damage or death in that region of the heart. As clear as mud, huh? I have found that the issue with picturing this is the overarching perception is that the heart is an organ that pumps blood to every part of the body. That is correct. But most may not think beyond that to, well, how is the heart itself getting the energy to actually pump that blood? It's no different than, for example, you. Everyone greatly appreciate all the wonderful things that you somehow managed to get accomplished with all your octopus tentacles, while all the while, you, my sister friend, you are getting depleted yourself. I digress. That's for another podcast, though. Well, the heart itself also has blood vessels. Yes, ma'am. You can see parts of the blood vessels that supply the heart muscle on most pictures of the heart. I'm trying to think of a common example here. Think of the heart like the engine of a car. The engine powers the car and keeps it running, while the heart powers the body by pumping blood. If the engine or heart stop working properly, the car or your body can't function the way it should. The vessels that are responsible for supplying the heart itself with blood, those are called coronary arteries. So the coronary arteries are like small tubes or pipes wrapped around the outside of the heart, the outside of the engine. If you ever pop open your hood and look and you can see the engine, there are typically a lot of things going to the engine itself. These tubes are very important because they carry blood filled with oxygen to the heart muscles so it can keep working. Those are the coronary arteries, as I previously mentioned. If these tubes get blocked, the heart can stop beating altogether because it's not getting the blood flow to give it the energy it needs to pump. That's like your car stalling out. Well, if the heart is a muscle and has its own blood supply, how does the blood vessels become blocked? What is the heart doing to cause the blockage? Great questions. Well, my sister friend, the heart is not doing anything to block itself, actually. It's all the delicious barbecue ribs, fried chicken, steak, cakes, donuts, all the things that taste oh so good. That's the beginning of the buildup of plaques in your arteries. This is called atherosclerosis. The plaque is composed of fat, cholesterol, and other substances. Abundance found in the blood from the delicious juicy burger with cheese, and don't forget the added bacon. This is the reason why your primary care, your doctors are getting on you about lowering your cholesterol and paying attention to your fat intake. It's not that they don't want you to enjoy food. They do, and I think you should, in moderation. But when you have an overabundance of fat and cholesterol, and they have nowhere to go, guess what they end up doing? Lining those vessels, like becoming a sludge in the pipe, and it builds up over time. We'll get more to how you can help keep those pipes clean, okay? So over time, This buildup of plaque narrows the arteries and restrict or decrease blood flow. It's all sludge. The buildup typically takes years, but that is changing too as more and more younger souls are having heart attack these days. Why? Because of the obesity issue that we have in our country. I remember growing up in Jamaica, we had a river runoff called a canal that was close to our home. It was a place for fun and cooling off those hot summer days, washing clothes, and more. However, whenever we have heavy rains, the water in the canal would be muddy from dirt from the mountains or wherever. It's dark and brown. It was just yucky. Think of that like eating a big burger or a rack of ribs. It muddies your blood with a bunch of fat and cholesterol looking for somewhere to go and be deposited if it doesn't break down. Back to the canal. This eventually clears a couple days later, right? But in the case of our bodies, other organs help to clear the gook in our bloodstream. Exercise is great for this also. However, sometimes, especially after hurricanes, uprooted trees can clog the river upstream, leading to no water in the canal for washing clothes, cooling down. The fish and other local marine life dies. Sometimes only a trickle of water comes down. That is to say, the plaque built up from cholesterol clogs up and can eventually block the arteries serving your heart and other places in your body too. We'll get to that later on. With common technology, sometimes the plaque can be cleared or a bypass can be created to allow the flow again to the heart muscle. If you had a rerouting of the arteries for the clearance, that is commonly seen in medical records as CABG, CABG, coronary artery bypass grafting. And this would be followed by a number to say how many arteries did they bypass or graft. But as you can imagine, time is of the essence. Life now hangs in the balance. A heart attack is a medical emergency and immediate treatment is crucial to restore blood flow, getting the heart pumping again, minimize heart damage, and improve your survival chances. Understanding these causes and recognizing the symptoms early can help in preventing a heart attack or reducing its severity. Now, I remember watching, was it Sanford and Son? And, he would grab his heart and say, "Oh, I'm having a heart attack." That is not truly how it presents itself in women. It's totally different. It doesn't have to be your left arm. It can be your right arm. It could feel like just a bad feeling in your chest or something sitting on your chest. It doesn't present typical way of a heart pain and a left shoulder pain and a left arm pain in women. The way it presents in us is totally different. So you have to be attuned to any changes in your body. And if you have questions, get to urgent care, get to the hospital, get to your primary care. You don't need to figure this out on your own, right? Your life hangs in the balance. No time for guessing or thinking you're going to drink some pink stuff or take a pill here or there. Or what did someone tell me they drink? Vinegar, right? I think it's vinegar for upset stomach. When you don't know, you ask. Again, for some reason, it's just different the way a heart attack presents in women than for man. After retiring from the military, some of my regular activities started to slow down a bit. And COVID didn't help either. I thought becoming a pescatarian would do the trick, but even after 15 years of eating mostly seafood, my cholesterol started to trend up. My canal started to get sludgy and dirty. What? Like, I'm not having this. It could be the sweets and my love-hate relationship with bread. Sister friend, can you relate? So, I had to do something about it. You can too. It is never too late. Okay, so here are the risk factors and numbers. Follow along to see if any of these applies. This is a great discussion to have with your primary medical team. You want to know if you're at risk for heart attack and what you can do to reduce the chance of that ever happening. All right, risk factors include, not limited to, high blood pressure, high cholesterol levels, smoking, obesity. Even if you think you're not obese, you're a little thick or just a little overweight, that is a risk factor. Lack of physical activity. If you are working from home and sitting at the computer all day, you need to have some kind of alarm where you get up on a regular basis to go do something, to walk around. And of course, having an unhealthy diet are all risk factors. Additionally, certain medical conditions like diabetes can increase the risk. Anyone in your family with heart disease? Also, age, especially over 50 and post-menopause. And stress are also important factors to consider. Yes, stress is also an important factor. Say what? I checked off a few of those boxes up there. How about you? As we say in the Army, about face, that means a 180 turn. Yes, you can do it. It's never too late to consider prevention mode by making a decision to change. Heart health and sexual health are closely interconnected as both rely on a healthy cardiovascular system, a healthy heart. The heart pumps blood throughout the body, and this circulation is essential for sexual function. A heart attack, which damages the heart muscles and reduces its efficiency, can directly impact sexual health. For example, reduced blood flow can lead to erectile dysfunction, ED, in men, as the clogging of the blood vessels affects blood vessels everywhere. Yes, this also includes the blood vessels to the penis. Clogged blood vessels may be too narrow or damaged to allow sufficient blood to reach the penis. Similarly, women may experience reduced libido or desire for sex and vaginal dryness due to decreased blood flow to the pelvic area. Vaginal dryness may also be due to hormonal changes, whether you're perimenopausal or postmenopause, that also has an effect. Erectile dysfunction is its own topic and we'll address in another podcast because their ED affects you as well. The menopause discussion is fast upcoming. Some of you may joke and say that sex is an exercise. You may call it sexercise. But sex is more along the line of like a semifinal. This podcast is to help some of you get off the bench and back into the game. Sex tends to use a lot of energy, and an orgasm by either party causes full-on exertion. So some of you are wondering, so what's the level of exertion during sex and heart attack risk? What should I do? How do I know? Well, sister friend, sexual activity is considered moderate physical exertion, similar to climbing 2 flights of stairs or brisk walking. For most people, sex places a modest demand on the cardiovascular system. The heart rate typically increases to about 130 beats per minute And that could be a lot for some. That could be no problem for others. So it really depends on your baseline activity. Sex should not be your only activity. I know some of you would like it to be and say, hey, it's a sexual activity. Why can't I just use that for my exercise? Sexercise won't work. You have to build up to it by doing other things to get your heart used to that strain, right? Or that demand on the heart. So when you're in a sexual activity, the risk will not be great. Can you trigger a heart attack during sex? For individuals with heart disease, the increase in heart rate and blood pressure during sex could potentially trigger a heart attack, especially if the person is not accustomed to physical activity or has severe coronary artery disease, severe heart issues. However, the absolute risk remains very, very low. The American Heart Association suggests that most people with stable heart disease can safely engage in sexual activity after consulting with their healthcare provider. Disclaimer here. Though my expertise is that of a medical doctor, I do not specialize in cardiac issues. I am not a cardiologist. I do not work in that realm. Additionally, only your primary health provider knows your overall health. So always consult with your primary team and or cardiologist for personal advice as far as what you should do and what is your risk factor. Please take heed to this disclaimer. There are lots to discuss with your primary health provider, and I will give you some hints later on about some things you could say and some common questions to ask. So, the risk of having a heart attack during sexual activity is relatively low, and studies estimate that less than 1% of heart attacks occur during sexual intercourse. According to a study published in the Journal of the American College of Cardiology back in 2012, sexual activity is responsible for only about 0.9% of all heart attacks. Yours may be higher or lower based on the discussion you have with your primary care team, right? Or your cardiac team. If you are concerned, please speak with your team. Survival rates after a heart attack are high when it occurs during sex, largely because the partner often calls for immediate help. However, the chances of survival can vary depending on factors like the speed of medical response and underlying health condition. Again, I said it before in some of my previous podcasts, the exercise is not bench pressing and all that stuff, just getting out for a little stroll, a walk regularly, 30 minutes, 4 times a week, just to get on a bike or get out and walk. It makes a world of difference. So what happens if you had no idea about all this stuff and now you or your hubby had a heart attack? You may have heard about heart attack in the distance, in the periphery of the others, but now that it's affecting you, it's now personal. What now? What next? Undoubtedly, the aftermath comes with both physical and emotional challenges that can profoundly affect your life. Immediately following a heart attack, many patients may experience fatigue, chest pain, and shortness of breath as the heart muscle recovers from the damage, right? Over the long term, these symptoms may persist and patients might develop complications such as heart failure, arrhythmias, which is irregular heartbeat, or reduced physical endurance. Therefore, regular follow-up with a healthcare provider, lifestyle changes, and medication are often necessary to manage these conditions and prevent future heart attacks. Before sex can emerge back into the picture, please consider how to be stable physically first. Discussing sexual health after a heart attack can be challenging due to the stigma and embarrassment that often surrounds the topic, right? There's this assumption of, well, you just had a heart attack. Why should you be caring about sex? Sex is also a part of life. Just as how you have to adjust your eating habits, you may have to adjust your sexual habits and your sexual appetite. Many patients and even healthcare providers may feel uncomfortable addressing sexual concerns, leading to a lack of information and support. However, it's crucial to overcome these barriers, as sexual health is an important aspect of overall well-being. Open communication with a partner and seeking guidance from your healthcare provider can help individuals navigate these concerns, and this will foster both physical and emotional recovery after a heart attack. Now, remember, everyone's heart attack is going to be different. Everybody is different. How far gone was it? How long did it take before they get to you? What kind of damage did you have? Did you actually have to have a surgery done, or did you just have a procedure where they clean out the plaque? The level of medical care that you receive to bring you back or get you back to stable, that is going to have an impact on the concern of addressing sexuality and when to return to that kind of activity. As you can imagine, the recovery after a heart attack requires rehab, emotional and physical rehabilitation. The road to recovery is a gradual process that involves healing in the physical and emotional realm. How long? The typical recovery timeline, as discussed previously, can vary. The initial phase, though, will focus on stabilizing the heart and preventing further damage, and they will work with you to help you regain your strength, go through a cardiac rehabilitation program, because that is essential, all of which are critical for reducing the risk of future heart attack events and improving overall health. This is serious business. So my approach is, why wait to go through something like that to prompt a change? Why not change now? I have heard some of you voice that the dietary changes are too restricting. You can't live like that. Did you hear that? You can't live like that. If you don't adjust, then you won't live like that. And why wait to have a drastic measure in doing the things you know you ought to do? Start doing it little at a time now. Nutrition is only a part of the rehabilitation process, though, right? You do not have to be a vegan and swear off everything, but the seriousness of a heart attack requires some drastic measures. Then things can be moderated after that. It is not the end. As long as you're still here, there is hope, right? Because of this apprehension, emotional barriers are common during recovery. Fear of another heart attack, which statistic says occurs approximately 25% of the time, anxiety about sexual performance, and changes in self-image, these can all contribute to stress and depression. Sister friend, you can overcome these emotional challenges. It requires open communication with your hubby. Counseling can help address fears and anxieties, while partner involvement can strengthen relationship and provide emotional support. There are a lot of information on physical rehabilitation, as it plays a vital role in helping heart attack survivors regain their strength and confidence. It's important to resume physical activities, including sexual activities, gradually and under medical guidance to ensure safety and effectiveness. Everyone, please hear this again. Gradually under medical guidance. Here's one of your questions. My husband had a heart attack 3 months ago. We were talking about past sexual encounters, and when I hugged him, he got an erection. I was so scared that I ran out of the room. What should I do about this? This is quite common, but I'm guessing that you ran because you thought if he had sex or an orgasm, he may have another heart attack. Correct? This is a tough one. Please talk to him. Share with him your concerns. Your involvement is crucial in his recovery process. You can provide emotional support and help maintain intimacy and connection even when sexual activity is limited or non-existent. Then, make an appointment with your primary care or cardiologist to talk about this. If uncomfortable with in-person appointments, try sending a note via your electronic medical records and schedule a teleconsult or telephone follow-up. Those have become quite common now since COVID. Well, what to say? What to ask? Here's an example. Dr. XYZ, when I hugged my husband, he had an erection, and I was terrified of him having another heart attack. Is that a realistic fear? Can we cuddle? What should I do if he gets aroused and have an erection again? When will it be safe for him to have sex and an orgasm? These are some good, engaging, frank, and to the point questions to ask. Remember, sexual activity is like moderate exercise, but everyone's moderate is different. How many flight of stairs would be considered moderate for you or for him, right? We have to be realistic about all of this. This is a terrifying way to live, thinking that you may be responsible for your significant other having a heart attack and possibly dying. This is serious. I wish I could be more specific for you, but as you have learned now, everything and everyone is different. Additionally, this is outside my specialty and I am not on your care team. But I do hope the suggestions here are helpful for you. At your appointment to discuss resuming sexual activity, also ask about holistic approaches to enhance sexual health after a heart attack. This approach can provide powerful tools in the recovery journey, integrating mind and body to promote overall well-being. Practices such as yoga, meditation, and mindfulness play a crucial role in this process. You will find that these activities help reduce stress, a significant factor in heart health, by promoting relaxation and emotional balance. Other alternative therapies also offer potential benefit for sexual health post-heart attack. Acupuncture, for instance, may help improve circulation and reduce stress. Massage therapy not only helps relieve muscle tension, but also foster physical closeness and intimacy. Clarification, that's a massage with each other, not at the massage parlor. Oh my goodness. A massage that you give each other. Please, clarification here. I'm not sending you to any special massage parlor. Oh my. Nevertheless, it's vital to consult your healthcare provider before trying any alternative treatment, as they need to be safe and compatible with your medical conditions and medication. Therapy and counseling, particularly sex therapy or couples counseling, are essential for addressing sexual health issues that may arise after a heart attack, as the emotional aspect of recovery are deeply intertwined with physical health. Counseling can help rebuild confidence, improve communication between partners, and ultimately foster a healthier, more fulfilling, intimate life after a heart attack. Well, sister friend, I know you have choices, So I thank you for tuning into Intimacy After podcast. You may subscribe for bi-monthly alerts or stay in the know by visiting my website at queenquanta.com. That's Queen, QUANTA.com. Until next time, remember, a life without intimacy is like your favorite meal without salt. Ladies, let's spice it up. Life is beautiful and God is awesome. This is Queen, signing out.